Hi, I'm Dr. Barone, and today I'm going to be talking to you about the brainstem and the manifestations of health problems due to brainstem compression from being out of alignment. He's an imposter! Get him out of there! I'm the real Dr. Barone. And let's talk a little bit about the brainstem, because it's something that we don't talk about enough in healthcare. We're going to talk about a revolutionary system of healthcare called upper cervical chiropractic. But before we do, we're going to talk about the brainstem and its connection with upper cervical chiropractic. You see, the brainstem consists of many centers: the medulla, the pons, the mesencephalon. Those are some words you don't have to be concerned about right now. But what you need to know is that the brainstem is an extension of the spinal cord upward into the cranial cavity, because it contains motor and sensory nuclei, which are control centers that perform motor and sensory functions, let's say, for the face and head region. In the same way that the anterior and posterior gray horns of the spinal cord perform these functions from the brainstem downward. So we have motor and sensory functions upward, we have motor and sensory functions downward. What are motor functions? Those are the things that you control. Muscle movements, things like that. What are sensory centers for? Well, those are for the things so that we can feel things. We can sense where our body is in space, pain, pressure, all of those things. So if you touch an iron, you know to move your hand immediately. The brainstem is intricately tied into these functions so that we can live and function and prosper how we're supposed to. Now, the other thing you need to know is that the brainstem in its own right is its own master. And you say, well, why is that, Dr. Barone? Well, that's because it provides very, very specialized functions. Well, what could be so important, Dr. Barone? What could possibly be so specialized that the brainstem does? And why haven't we heard more about the brainstem? And why is the brain stealing all of the glory? Well, I'm going to tell you right now. The brainstem controls respiration. The brainstem controls cardiovascular function. The brainstem is the control center for the gastrointestinal system. Yes, GI. What does that mean? Diarrhea, constipation, irritable bowel syndrome can all be the result of brainstem compression affecting this control center. It controls equilibrium. What is equilibrium? It's your ability to be balanced in your environment so you know where you are. Have you ever been upside down in a play set or like in a jungle gym or something like that, and you stand back up upright and everything seems strange and you feel disoriented? Or you go on the Gravitron right after you had some corn dogs at the family local fair, right? And all of a sudden you feel sick and disoriented. All right, that is equilibrium problems. The control center for equilibrium is in the brainstem. So if you have problems like that, it could be a brainstem issue. The other thing I want to talk about is eye movement. Your ability to look to the left, look to the right, look up, look down. How did I do? Okay, good, probably because I was just aligned. I'm adjusted. So my body is in alignment. What that means is that my atlas vertebra is not compressing my brainstem. And because of that, these control centers are doing what they're supposed to do. And when they don't do what they're supposed to do, we've got a lot of problems. All sorts of health problems can show up. Now here's the other thing you need to know, is that the the brainstem also acts as a way station. What I mean by that is the brain will send signals to the brainstem to basically interrupt or change signals to other areas of the body. Okay? So it can act as a relay station or a way station for the other part of the body. Now that's very, very important. Would you agree? Absolutely. So now let's talk about how the brainstem gets interfered with. We've established that the brainstem is very, very important to your overall health. And again, this is a health secret that very few people know about. So when they have symptoms in their body, they go chasing those symptoms with things like pills and therapy and shots and these sorts of things. But they don't look at the brainstem. The brainstem is critical to your overall health. Well, what possibly can affect your brainstem? Well, I'm going to show you that right now. Now, this is called the occiput. And basically, it's the occipital bone, and it's part of the skull. Okay? This vertebra here is the first vertebra at the top of the spine, called the atlas. And then this vertebra here is called the axis. Now, the atlas vertebra connects directly to the brainstem. There's two ligaments in there called dentate ligaments. Now, you can't see it on this model, but there's two little ligaments that go from the inside of this vertebra and they attach to the brainstem. Now, what happens is when this vertebra misaligns, See that movement? Very subtle. When that vertebra misaligns in relationship to the skull, those dentate ligaments affect the linings of the brainstem, and all of a sudden we're interrupting control centers. One of those control centers affects the extensor musculature throughout the body. So what does that mean? Well, not only are you affecting the control centers directly, but the brainstem in essence decides or determines where the rest of the spine is in space. I hope you all can see this, but this is a spinal column. Here's the occiput again. Look familiar? I just taught you what that is. Here's the atlas vertebra. Very special. There is no disc. Notice these nice little spongy spaces between all the vertebrae. The atlas does not have one. So it's freely movable. And the facets, or the joint spaces, are flat. The rest of them aren't. They're more straight up and down. So what that means is accidents or injuries at some time in our life will cause that vertebra to misalign, like we talked about. Now when this vertebra misaligns, the whole spine shifts like a stack of dominoes. Watch again. Very important. When this little bone misaligns, the whole spine shifts like a stack of dominoes. Now what happens? Well, our shoulders are attached to the spine, so we have one shoulder higher or lower than the other. Our hips become contorted. Now we have one hip higher or lower than the other. That puts abnormal pressure on the hips, knees, ankles, feet. What kind of symptoms might you have if that occurs? Hip pain, knee pain, osteoarthritis or degeneration will develop because it's an abnormal wear and tear, progressively worsening condition that causes arthritis and degeneration in the body. Now, we have one other problem. The central nervous system and peripheral nervous system are affected. Now, the brainstem is part of the central nervous system, the brain and the brainstem. And then we have these peripheral. Look at all these nerves. These nerves are what keep our body healthy. See them? They're all over the place. There's 31 pair of nerves that come out of the spine alone. Not to mention it affects the autonomic nerves. What are autonomic nerves? Those are the nerves that control the autonomic or automatic functions in your body. When you're out of alignment, make no mistake about it, every cell, every chemical in your body is affected to some degree. Does that mean that it is a factor in cancer? Yes, it does. Does that mean it's a factor in chronic fatigue syndrome? 100%, absolutely. Does that mean it's a factor in fibromyalgia? Absolutely. Migraine headaches? Yes, because we have nerves that travel up into the skull, and when they're affected, we can get a hypoxic condition due to lack of oxygenation in the brain because of the closing down of blood vessels. We need those opened up or normalized. We don't want to get things bigger or smaller. We want to normalize the system. How do we normalize it? By removing brainstem pressure and allowing the spine that's contorted to come into a balanced state so your hips are level, so your spine is straight up and down, so your head is balanced on the atlas vertebra that we talked about. There should be a 90-degree relationship between the center of your skull, the center of the atlas, and the spine below. This concludes our lesson for today. Thanks for joining me, and we'll see you next month.